Of a pandemic after a virus infects 15 people and killing 9 of them. Despite those relatively small numbers, when you think about it, scientists are already comparing this to SARS, which killed nearly 800 people a decade ago. The World Health Organization also issued a global alert for this virus. Scientists recently confirmed the first case the case that has the person-to-person transmission that always raises a lot of concerns. And the early symptoms include things like fever, a cough, shortness of breath. Dr. William Schaffner is the chief of preventive medicine at Vanderbilt University Medical Center. He's also a former president of the National Foundation for Infectious Diseases, which makes him the perfect person to talk to about this. You know, Doc, we know so little. Why is there such concern about this virus?
Hi, Jenna. The reason there's concern is that this virus resembles molecularly in the laboratory the original SARS virus of a decade ago. And we'll all remember that SARS exploded out of Southeast Asia, was transmitted all across the world, and caused many, many deaths. It was highly, highly transmissible. And so now we have a new SARS-like virus that has suddenly been identified. It's not as transmissible, fortunately, but it still has a high fatality rate. You bet. We're keeping an eye on this virus.
How do these sort of outbreaks work? If there is indeed an outbreak of this virus, does it virtually happen overnight like the movies, you know, it goes 0 to 90 all of a sudden? Or is it more gradual than that?
Well, these days we have a new technological capacity to identify these new viruses. And so we're learning more about new viruses all the time. We have more information. This outbreak is kind of smoldering along. There are cases being identified, and the World Health Organization has all of us around the world, infectious disease doctors, public health officials, on the alert, so that if anybody comes to the United States from that part of the world, the Middle East, and has a funky pneumonia, a pneumonia that we can't identify right away.
You said that it's a weird pneumonia because some of the symptoms sound like a common cold. So what would stand out specifically about this?
Yeah, these are pneumonic illnesses, illnesses that involve the chest and the lungs, with cough, fever, serious illness, and if you take x-rays, you'll see that the lungs are involved with pneumonia. We would get specimens and send those to our reference laboratory, the CDC in Atlanta, that would do the investigations to see if this virus is involved. And we're all on the alert for this.
It's good to know that people are on the alert. There's some big questions about what Saudi Arabia is doing to help this process, because apparently that's where several people came down with these cases, and there's a question of whether or not we're getting the right information about it. Dr. Schaffner, we look forward to having you back as always. Thank you, sir.
My pleasure.